Among younger people, it says more people are getting colorectal cancer and more people are dying from it. While the cause of the uptick is not clear, doctors say they do have theories about what may be driving the rise. Our George Stephanopoulos has more.
Doctors are sounding the alarm about cancer diagnoses on the rise in people younger than 50. David Tao was 34 in 2019 when he learned he had stage 3 colorectal cancer without any family history of the disease.
I was always one of those people who thought, I'm young, I'm healthy, rub some dirt on it and kind of get back out there. But my reaction was shock.
David is not alone. Colorectal cancer is the 4th most commonly diagnosed cancer in the U.S. for men and women. Colorectal cancer has seen more than a 46% increase in early onset cases from 2000 to 2019.
Colorectal cancer in young people is most often diagnosed at very advanced stages when it is less likely to be cured. And maybe the scariest thing about that is that we actually don't know what is driving this uptick.
Colorectal cancer is just one of the several common cancers on the rise in young adults under 50 in the past 20 years. All cancers are on the rise, nearly 13%. With notable upticks in diagnoses for breast cancer and stomach cancer. One study found 8 of the 14 cancers under review were in the digestive system, suggesting diet and lifestyle might be playing a part in young people's diagnoses.
Getting a lot of physical activity in, following a healthy diet mainly composed of fruits and vegetables and less than red meat, not smoking, not drinking, and trying to maintain a normal body weight are all very important things that we can all do to try to decrease our risk.
As for David, he believes that education is the key to maintaining your health.
Get looked at, be an advocate, understand what these symptoms could mean, and do everything that you can to get checked out.
Our thanks to George Stephanopoulos for that story. ABC News medical contributor and physician at Stanford Children's Health, Dr. Alok Patel, joins me now for more on this. Dr. Patel, we just heard these, alarming statistics and that it may not have a reason, or we don't exactly know why cancer is showing up more in younger people. But what does the research show? What is likely the cause for this?
Mona, one thing that the research does show that this is not just in gut cancers, but since 1990, there's been a rise in multiple different types of cancers, including gut cancers, but also breast, esophageal, liver, kidney, bone marrow cancers. Now, here's the thing. Our genetics haven't really changed since 1990, but all these things surrounding our lifestyle have progressively been changing over the decades. Harvard researchers actually use this term, the exposome, to refer to everything that could be influencing our risk factors like lifestyle, diet, a lack of sleep that we've been getting, stress, eating processed foods, sugary foods, and the rise of some chronic illnesses. So this might all be contributing to what we're seeing.
And women are obviously, there's recommendations for women to start getting mammograms at the age of 40 instead of waiting until 50. So why is early screening so important?
Early screening is everything in terms of early detection, potentially treatment, and avoiding those late complications. Now, we sometimes hear these stories of young people saying, hey, I had chronic weight loss, I felt pressure, I felt pain. The problem there is you may actually be in a situation where your illness, your cancer has actually spread to a later stage. So you mentioned breast cancer screening now being offered at early as 40. People with average risk can be offered colon cancer screenings at 45, but there's also screenings for prostate cancer in certain individuals. And I want to plug cervical cancer screening as well, which can start at 25. Skin cancer screening also, just checking your skin to make sure there's anything there. And when in doubt, talking with a healthcare professional about what your risk factors might be.
And what can young people do, or what can anyone do to reduce the risk of getting cancer?
There's so many things, and I think it really starts to us paying attention to our lifestyles, what we're taking in, how active we are, what we're doing regarding our sleep, reducing our risks of obesity. I can't say it enough, but not smoking and reducing how much alcohol we take in plays a big part as well. And obviously, looking at your own family history, your own risk factors, any medical conditions you may have that could increase your risk of having any types of cancer, and checking in with a doctor. These are all incredibly important steps to follow. Not only for you, your friends, your loved ones, spread the word.
And what about the people who are already doing this, though?
Well, people who are already doing all this, awesome. Maintain it, but it's also important to still check in with your doctor, because even people who are average risk should still be talking about getting cancer screenings at the appropriate age.
That is great insight and advice, Dr. Alok Patel. Thank you so much for joining us.
Thank you.
Appreciate it.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.